you had a choice. You could have had a saline implant, which is salt water,
Mm-hmm.
or you could have had a silicone gel breast implant.
Yeah.
And which one did you choose, and why did you choose it?
Well, at first, I wanted saline because I heard, a lot of things about silicone, which I had questions about. And you told me that silicone was going to be better for my case.
All right.
And I got under the muscle. And when you told me silicone, even when you feel the difference between the two, between saline and silicone, silicone feels like more natural. Saline, you're like, okay, little...
It's like a water balloon.
Yeah,
like something
exactly.
you might have at a pool party.
Yeah. So, by that, seeing the difference, just seeing first, yeah, you're going to pick silicone. It feels way better. And then after I explained to you I was scared about getting the silicone, because I didn't know. There's things said about silicone, but the reason why I chose it is just you explained to me why it fit my body. And so I was like, okay, let's do it.
Yeah, I think that a couple things. Silicone feels more lifelike for sure, and I think it's fair to say that in the long run, there's much less of a chance of you having issues with a silicone implant failing.
Yeah.
The thing you have to worry about with saline is that if you get a tiny little hole in a saline implant, that salt water is going to leak right out of that hole, and you're going to have a deflation or a flat tire, and like it or not, it's going to cost some money to get that thing replaced. Silicone, on the other hand, is a very cohesive material. Cohesive meaning it's sticky, it's gooey, it's like Jell-O. It's going to stay together, and it's far less likely to escape through a similarly sized hole in the shell. So that's one of the reasons why I think silicone is a lot better. Plus, silicone is safe. Silicone is ubiquitous. It's just everywhere in our environment. It's in milk. It's in vegetables like salads, things like that. It's just everywhere. It's in the air. And we as human beings walking on this planet Earth have become very accustomed to silicone being right in our environment. And so it isn't something that is going to hurt us. It's the analogy that I make to patients that question the safety of silicone is that the air that we breathe is only 20% oxygen, and it's like, 80 or 60 or 70 or some huge percentage is nitrogen, which is a gas that we don't really use per se when we breathe. And so likewise with silicone, it's everywhere and it doesn't hurt us. It's fairly inert, and so it's a good material. It's a great material. It isn't a very good material to use as an injection in the breast or in other parts of the body like the lips or the face. Although silicone injections are used by urologists and other people for sphincter type applications, but and silicone is also used by ophthalmologists for retinal detachments, things like that. But as far as breast augmentation is concerned, silicone needed to be contained within a shell. And the first generation silicone gel breast implants, the problems with those implants were the silicone was so nice and soft and fluid and lifelike, but it was so at the same time similar to the shell of the implant that it would actually pass through the shell of the implant. And that's what really caught the attention of Connie Chung and those that kind of drew attention to the fact that we didn't really know a lot about silicone and its safety. And that's what brought on the accusations that silicone was not safe. And unfortunately, the manufacturers did not have adequate data to support the claim that silicone was safe. So there was this moratorium on silicone that lasted pretty much throughout the 80s and the late 80s and 90s, at which time saline implants were essentially the only implants that the vast majority of plastic surgeons in the United States could use. I fortunately was one of the very few plastic surgeons that was invited to be a clinical investigator in the clinical use or application of silicone gel breast implants, and so I was one of maybe 40 doctors that did have a lot of experience with silicone gel, cohesive gel implants, and I was participating in a lot of the research that is now being used by the FDA to gradually introduce silicone gel breast implants back onto the market.